Hello everyone. Let us learn today identification and side determination of first rib. Now first rib is the shortest and broadest and the most curved rib in our body, and because of this first rib is known as a typical rib. Now let us compare this typical rib with the first rib. This typical rib has a twisted shaft. The shaft is a bit twisted, while in first rib the shaft is mostly curved. Then the thickness of first rib is more, while the thickness of a typical rib is very less. And we can compare the size also. The size of the first rib is very short, while a typical rib is much bigger than the first rib. Also, there is no costal groove in first rib, no costal groove, while if we see in a typical rib, in the lower border of a typical rib, we can easily see the costal groove. Now this is the costal groove present in the lower border of a typical rib. The first rib is flattened from above downwards. This rib has two borders and two surfaces. So it has a superior surface, this one, and an inferior surface. It has an inner border and a outer border. Now regarding the side determination, this is the anterior end of first rib. Now this anterior end is larger and thicker, and it is deeply pitted, while just opposite to it, this one is the posterior end, and this posterior end is rounded, while it has an outer border which is convex and devoid of any costal groove, an inner border which is concave. Now the upper surface of the shaft is crossed by two shallow oblique grooves. As we can see over here, these are the two shallow oblique grooves divided by a faint ridge. There is a faint ridge here. This one is the faint ridge. This faint ridge continue as the tubercle, this one, and this tubercle which is present on the inner border of first rib is known as scalene tubercle. So this rib has a superior surface, an inferior surface, an inner border and an outer border, anterior end which is broader, posterior end which is smaller, and by this we can say that this first rib is of left side. Now another way to determine the side of this first rib is you have to put this first rib on a flat surface like this, and you have to see that the anterior end and posterior end of the first rib touch the flat surface simultaneously, and there is no space here. While if we put the first rib like this, we can see that both the ends were unable to touch the flat surface. Now the anatomical position. As we have already discussed before, this is the anterior end and this is the posterior end. The anterior end and the posterior end are not at the same level in anatomical position. The anterior end is 2 to 3 centimeter below than the posterior end, and this is how it is oriented in the anatomical position. Now, general features of first rib. The anterior end is larger and thicker than that in the other ribs. It is continuous with the first costal cartilage, while the posterior end comprises of a head, a neck, and a tubercle. The head is small and it articulates with the body of first thoracic vertebrae. Let me show you. Now, this is the first thoracic vertebrae. This vertebrae resembles that of cervical vertebrae. It is broad. The body of this thoracic vertebrae is broad and not heart-shaped. Now, on the body of the thoracic vertebrae, it has two costal facets, superior costal facet and inferior costal facet. Now, superior costal facet in thoracic 1 vertebrae is complete, while the inferior costal facet is incomplete and it is known as demifacet. Superior articular facet articulates with the head of the posterior end in first rib like this, and they together form costovertebral joint. Now, the neck of first rib is directed laterally backwards and it is mostly rounded. Then the tubercle. This tubercle is large and it articulates with the transverse process of first thoracic vertebrae. Here, now these are the transverse processes of first thoracic vertebrae, and this is the tubercle. This tubercle articulates with the transverse process of first thoracic vertebrae like this. Now, the shaft or body of the first rib has two surfaces. This one is the upper surface, this one is the lower surface. Upper surface is bit rough, while the lower surface of first rib is smooth. It has two borders, an inner border and an outer border, and on the upper surface, as we already know, that it has two shallow grooves divided by a faint ridge which continue as the scalene tubercle. Now, attachments and relations of first rib. Anteriorly, the neck is related from medial to lateral side to sympathetic chain, posterior intercostal vein, superior intercostal artery, and ventral ramus of first thoracic nerve, and the mnemonic of these are chain pulling the vein. Superiorly, the neck is related to deep cervical vessels and 8th cervical nerve. Now, the anterior groove on the upper surface of the shaft lodges the subclavian vein, while the posterior groove of the shaft lodges the subclavian artery with the lower trunk of brachial plexus. Then the subclavius muscle. The subclavius muscle takes origin from the anterior end of the first rib, while there is a ligament known as costoclavicular ligament. That ligament is attached just behind the subclavius muscle. The scalenus anterior muscle is inserted on the scalene tubercle. Then the scalenus medius muscle is inserted on this roughened area just behind the subclavian artery, which is present on the posterior groove. Then the lower surface of the shaft is covered by costal pleura and is related near to its outer border to the small intercostal nerve. The external intercostal muscle takes origin from the outer border of the first rib. The upper part or the first digitation of serratus anterior takes origin just behind the groove for subclavian artery, and the inner border gives attachment to the suprapleural membrane.